One of the most prevalent digestive complaints is heartburn. And one of the most common causes of heartburn is low stomach acid. So obviously, to resolve this, you need to increase the stomach acid. Unfortunately, the conventional way of thinking is that, when a person is getting heartburn, they've got too much stomach acid. That happens, but that is hardly the case. Okay, so stress will cause you to have low stomach acid, because when you are very stressed, the message you send into the body is that this is not time to eat, there is an emergency. So all the resources are not going towards digesting and recovering. You have created an emergency in your body, because think about it. If you were in an emergency situation, would you be eating? Would you be enjoying a meal? No, you'd be running away. So the body is clever. If you give it the message that you are stressed, right, it stops producing these digestive juices for you. And then you eat food. Once you've eaten the food, it gets into the stomach pouch. For the food to leave the stomach pouch, it needs to reach a certain acidic pH. Okay, but if it stays there for too long, usually invariably we eat carbohydrates. These carbohydrates will start fermenting in the stomach pouch, and they produce all these gases. The gases will push the valve at the top, and the contents of the stomach will enter at the top or into the esophagus, and this is where we feel this burning feeling. So the solution is obviously to address stress by things like breathing, things like relaxing before you eat the meal. But if the stress is not going away, think of taking things like betaine hydrochloride to help you digest the food, digestive enzymes, pancreatic enzymes, so support your digestion so that you don't get this situation where the food is sitting in the stomach pouch for very long. And it's always important to think that if I've got heartburn, what makes my heartburn worse? For some people, is drinking too much coffee. It can make them, the symptoms worse. For some people, is eating too much fatty food. So sometimes what you can do is that if you're going to have a fatty meal, make sure that you've got your digestive aid, nearby. So I'm talking about the hydrochloric acid, the Swedish bitters, the gingers, the pancreatic enzymes. So you choose what you can use, what works for you. But definitely, the problem with heartburn is a question of somebody not producing enough stomach acid, not producing enough digestive enzymes.